Okay, we're good to go.
Good evening, everybody. Am I still muted? No.
You're good, President Thomas. It's Camille.
All righty. Let me just, sorry, I got to call up an item here. All right, let's see here. All right, good evening, everyone. This is the regular board meeting of the Boulder County Board of Health on Monday, April 11th, 2022. Time is 5:32. Can I ask all board members to introduce themselves? I'm Greg Thomas, Board President.
I'm Morgan McMillan, Board Vice President.
Brooke Harrison, board member.
Andrew Fagan, board member.
And Lindy Hinman, board member.
Okay, thank you. We have all the board members present and we do have a quorum. So this regular meeting, and then I guess for staff introductions, Camille, do you want to just kind of do that as staff are scheduled to present, just to
Yes.
introduce them? Okay.
Yes, that's much more efficient, sir. Thank you.
Yep. Okay. This regular meeting of the Boulder County Board of Health has been called to the order at discretion of Executive Director Camille Rodriguez. Notice of this meeting was posted on the Board of Health's website as required by law and included the teleconference phone number and conference ID. So members of the public could participate. We're still under the current the COVID-19 pandemic protocols, and I think maybe we'll be looking to change that here as early as next month if we can get all the logistics to coincide. More on that shortly. Okay, item number 1 on the agenda is public comment for any items not on the agenda. Do you have any public comment?
We do not, President Thomas, have any
Okay.
public comment.
All righty. Then I'm going to just call up my agenda here. Okay. Sorry, I'm a little discombobulated. I apologize. Okay. So item 2 is the approval of the March 14th, 2022 regular meeting minutes.
This is Morgan. I move to approve the March 14th, 2022 regular meeting minutes.
This is Brooke Harrison. I second.
Okay, motion and a second. All in favor? Aye.
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 Okay, item 3, COVID-19 data policy and program update.
Thank you, President Thomas. This is Camille, and I will call forward. I'm not exactly sure which staff is starting first, but Steffi, are you going first? Steffi Goodman, one of our surveillance team members. I see Indira sharing the screen, so I wasn't sure exactly who all on the team was starting first. I apologize.
Yes, good evening. Steffi has the evening off, so I'll be sharing today. Okay, let me go ahead and
introduce yourself, Dr. Gujral, please.
Sure. So Indira Gujral, I'm the division manager with communicable disease and emergency management at Boulder County Public Health. I use she, her pronouns. And I'm going to provide some COVID data updates along with Salam and Keith And we're going to discuss kind of also what's happening with the program and some of the program planning that we're doing. So Boulder County Public Health recently discovered an issue with in reporting of case data that resulted from a large backlog of cases that occurred during the Omicron surge. So this is back in January and late December, early January. And the issue has been, it's slowly getting rectified as cases are becoming more available to us. This was just due to the sheer volume of the number of cases that occurred at that time period. But it does reflect a change in the distribution of the cases that were reported. So you'll see some slight changes than what you've seen in the past. And we do continue to have a large backlog, but we'll be working through that kind of slowly. Again, this is all from a couple months ago, but just wanted to make sure you're aware. Just also a reminder that we've moved from tracking transmission of COVID into tracking the COVID community levels. And this is based on 3 indicators that are looking at case numbers, hospital beds in use, and hospital admissions. I'm excited to report that our hospital systems, the stress on the hospital systems is quite low right now, and our community level is low. And currently what we're seeing is approximately 38% of the cases, probably closer to 40% by now, this was last week's data, are that stealth Omicron, that BA2 subvariant. And so we're starting to see those become more and more, comprise more of those cases. And then at the end of this COVID presentation, what we'd like to do is have a conversation with you all about looking at how often you would like to have a COVID update at the Board of Health. So given that these community levels are really low in Boulder County and across the state, are we supportive of taking a break from the COVID Board of Health updates, given that you are receiving those weekly updates for Stephanie Goodman's great data? So when we take a closer look at the community level, the 3 indicators that make up the community levels, we are seeing that we're doing fairly well. And our COVID cases per 100,000 are less than 200. We're currently at 72.35 per 100,000. And so what the CDC has done is they've basically stratified whether you have fewer than 200 per 100,000 or greater than 200 per 100,000. So we are fewer than 200 per 100,000. And when you look at the second indicator, our hospital admissions are super low. We're really excited to report that. And our percent of staffed inpatient beds occupied by COVID is also extremely low. So this is really great news for us. And it's also great news for the whole state, in which the community level map is showing that almost all counties, I think it's the San Juan Basin down there, that's in medium transmission, or medium community level, are doing really well. And they do say, the State Health Department does report that some of these smaller communities like San Juan are likely to fluctuate between low and medium, and that's just because they're small communities with small denominator data, and but nothing to be alarmed about. When we take a closer look at our COVID cases among Boulder County residents, we see that our 7-day cumulative case rate is 79.2 per 100,000. And it's just a slight increase from last week, which was 74.3 per 100,000, nothing that we are too concerned about. And just keep in mind that at the height of the Omicron surge back on January 15th, our rate was over 1,700 per 100,000. So we feel really good about where we're at. And the yellow line represents that 200 per 100,000, which is the stratified level for those community levels. When we take a closer look at the case trends among different age groups, we see that they're all below the 200 per 100,000, and that they're going to bounce around a little bit with slight increases over these past few weeks among 35 to 44-year-olds, and I expect also the 23 to 34-year-olds. But we are feeling pretty good, and we've seen some decreases among some of the other age groups like 12 to 17-year-olds and our 18 to 22-year-olds. We expect some fluctuation among that. Okay, So taking a closer look at our testing among Boulder County residents, this is the data that's presented through April 6th. So this is approximately like a 3 to 5 day lag between the time the test is conducted and when they're reported to the state health department. The 7-day PCR positivity is 5%, which has increased from last week's 3.8%. But just keep in mind, there was an average of 770 tests done per day in the last week, compared to 929 that were done in the week prior. So what we might be experiencing here is fewer people are going to get their testing done at a community site or a place like a primary care provider, as more people will start to get tested at home. And so what that means is that our denominator may be decreasing. And so we may be seeing these 7-day positivities jumping around just due to that factor of home testing increasing in the community.
Hey, Indira,
Yeah.
sorry to interrupt you. Two questions for you. One, are they still planning to shut down the testing site at Stasio at the end of April?
I believe it actually shut down already, but
Oh,
maybe
okay.
end of April. I thought it was end of March, but I can confirm with Chris on that. But
Okay.
yeah, the community testing sites will be shutting down. What you will see though is that the Centauris, like the sites that are being hosted by the school district, are going to stay open. So that makes it available for people from anyone in the community who wants to go.
And I have a feeling we have no idea how to get at this data, but is there any sort of general consensus or research around how many at-home tests are being reported to CPHE?
A really good question, and I can ask the state that. I'll write that down on my to-do list. What percentage of at-home tests? But there was a MMWR that just came out, which did talk about when we have more people who are doing at-home tests, it will start to change the landscape of who is actually going for those larger community testing sites. And that includes like individuals over 70, people of color. There's a number of different factors that we expect to, so it might look like we have disparities, but in fact, those disparities may not be real, because we're not getting everybody who's doing an at-home test to report in their positive status. So I'll look for that MMWR and share that with you, because I know that Kaylin just sent that to me. Okay, so just taking a closer look at hospitalizations in Boulder County. We have 3 people hospitalized with confirmed COVID. 14 staffed ICU beds are available. So you can see that our resources are not being tapped right now. We're looking really good. And across the state, the Children's Hospital is reporting that there are 8 pediatric cases hospitalized across Colorado. Okay, so there have been 133 deaths since May of 2021. And to date, we've had a total of 391 deaths. Since May of 2021, 37% of those 133 deaths were among those associated with long-term care facilities. And among the 133 deaths, the average age of death is 72 years old for those who are unvaccinated and 83 years old for those who are vaccinated. And then just a quick couple highlights about our COVID response. We are in this place of doing a lot of action planning right now. So as we move into kind of this state of endemicity and we move into an endemic state, meaning that COVID is just with us for the long haul, what we're seeing at the federal level, the state level, and including our own local agency level, is that we're all kind of taking a pause, we're doing an assessment, and we're really kind of planning for stages for future surges. And so what this allows us to do is make sure that we have appropriate resources, that we're not over-resourced, and making sure that our resources match our abilities to handle future outbreaks or anything that might come our way in the future. On the testing side, the testing landscape is changing. We know that community rapid antigen test dissemination continues. So this is really good. So the state health department, if you want to call and get your rapid test, you can still order them from the state health department. And they are continuing to provide those rapid tests for places like jails and shelters, which are considered our high-risk environments for COVID transmission. We're working with CDPHE on a test to treat rollout, which is a way for you to get tested and then go and immediately get like Paxlovid or one of the treatments that will help to ameliorate any of the poorer outcomes that we might see. So this is exciting, but we are having to work on getting Boulder County providers enrolled in this. So it's a little bit of a systems push on this on our end. And then we are coordinating with our hospital partners to ensure preparedness for the summer and fall, what we potentially might see in terms of surges. And then lastly, I just want to share that we have been working really closely with our staff and ensuring we have a sustainable workforce for the future. So not only preparing for those future surges, but also making sure that staff are recovering from any burnout or any exhaustion that they might have felt over the past few years. And then as part of our ELC grant funding, we continue to offer our equity trainings and monthly conversations around courageous conversations on race. So I'm going to turn it over to Salam. Salam, do you want to introduce yourself first? And then we'll...
Sure thing. Thanks, Indira. My name is Salam. I am the school liaison and an epidemiologist on the Boulder County Public Health K-12 team. I'm here, I use she, sorry, I use she, her pronouns, and I'm here to present for ECE and K-12. Since April 1st, the ECE team has seen one outbreak in their ECEs out in Lafayette. And since April 1st, knocking on wood, the K-12 team has seen no new COVID-19 outbreaks since April 1st. Both the K-12 team as well as the ECE team were working with our schools and ECE programs to brainstorm about testing for the future. Most schools, at least, feel pretty confident and comfortable with testing resources that are currently available and through the end of the school year, but we are talking about summer and what next school year might look like. We're also, both the ECE team and the K-12 team are helping to prep for summer camps that are coming up. We're looking at the ECE team in particular is offering consultation services to any camps that would like to have them, where we can review their COVID-19 mitigation policies for the summer and advise on best practices. Right now, the day camps are recommended to follow ECE and K-12 guidance, and we're of course recommending CDPHE guidance. And it sounds like CDPHE is working on some guidance for residential or overnight camps that should be coming out in the next couple of weeks, hopefully. And I'm not sure who I'm passing it off to.
Okay, I think Keith is up next.
Hello, everyone. My name is Keith Rawls. I'm the immunization program coordinator, and I use he, his pronouns. COVID vaccinations. We're embarking upon the 6-month to 4 years of age vaccine. As soon as we get through this delay, we are now in discussion with focus groups as well to learn more about parents with children under 12 about vaccines as well to take on hesitancy. But in the meantime, we are now vaccinating the 50 plus with boosters. It's increased our clinic output from the teens to upwards over 50 on average. So that's going smoothly. We're also engaging the community with community clinics in the field at the Pride celebration in June and Cinco de Mayo coming up as well. Next slide, please. Yes, so there's a lot to celebrate with our efforts over the last 2 years. Countywide, K through 12, Boulder County leads the state, 64.2% of Boulder County schools are fully immunized for COVID. So that's something to celebrate. Thank you. And Indira, I think it's back to you.
Yeah, we're really excited about the K through 12 data. It looks really good. And really grateful to work with a community that is supportive of doing COVID vaccination. So we just wanted to pass it back to you as the Board of Health and have a discussion that, given our state and local community levels are looking pretty good and we're in this low period, is the board potentially supportive if we take COVID Board of Health updates, like take a break until August, or resume if there was any surges or any conditions that might have changed? So I just want to open it up. Marcus?
Yeah, thanks. I just, on the end of the vaccination success, I did read that Boulder County has the smallest equity gap in vaccinations. Is that right, in the state? No, you're shaking your head, Indira. I thought I read that in an article last week that was sent out. So I wanted to give kudos for all the work that's been done to try to address equity in vaccine rates, but maybe I am not remembering that correctly.
No, I think there was a misunderstanding with the reporter. They had said that we were the top, but we're actually third. So Denver is, I think we're tied for third. Denver is number one, and we're not too far behind Denver. And we're hoping that the state will potentially release that data to share across all the different counties so we can see how we're doing, because we do think it's really important for us to know as a region how we're doing. But yeah, we've been working really hard on this, and we continue to work really hard, and we do have funding for 2 more years to keep working on addressing those disparities.
Well, it sounds like kudos are still in line, even if not the top spot. So good job and keep working on it.
Yeah, I will say that we are number one with the K through 12, which is really exciting for having the highest rates in that age group.
Brooke?
Yeah, I would be in favor of taking a break from the routine COVID updates and maybe just throwing an update as needed when there's something important that should be brought to us. Also, because we should free up some time for some of the work that you all will be returning to as COVID ramps down. So we're going to need more time to discuss that.
Landry?
I was gonna say the same thing. I think it would be nice to have a little update. You know, I can understand wanting to take a break, but I still feel like it's the biggest public health issue. And I agree it hijacks the meetings, but I think maybe even just a one-liner, like a little update each time would be good. So we have a sense of how things are going.
Lindy?
Yeah, same comment as Landry. I think just given how it seems to still be evolving and changing, and it's hard to decipher based on what you read, I think it would be helpful to just get a brief update if possible. We may change that perspective as we go on, and if it's consistently the same update for months, but I do feel like this needs to stay front and center for some time, but not taking a lot of airtime in the meeting.
And I would echo the same comments. Question for Indira. So Indira, do you envision, if we're talking about maybe a future surge, that the community testing kind of setup would come back? Or do you think the rapid testing combined with test and treat or private providers would be sufficient to address future surges?
Yeah, I think that's a really good question. I know that the state health department is holding back some of their ELC funding. So they got a large amount of money for ELC, which really funds our epidemiology capacity. And I know that they're holding back some of their funding to see if they need to set up community testing sites. So the state still has community testing sites. They're just starting to roll back a lot of them based on kind of the need and the numbers. And they are really taking an equity-based approach, which might mean that certain communities might get a community testing site where we might not get it. And that might have to do with, our ability to serve our community. And so it's very possible that we might need them in the future. I know Chris Kimball is going to have to work with the fairgrounds or other spaces and figure out where to locate them in the future, because the fairgrounds, has a pretty hectic and busy schedule. In terms of test to treat, that test to treat system has to be built out. And I think we're kind of in the beginning stages of what test to treat will look like. So it's very possible that we might come back and share information with you in a couple months and have a better understanding of what that system will look like. Many of the federally qualified health centers are actually on the federal side required to do test to treat. So it could be that we just have to come back and kind of reassess the changing landscape of testing within the community and see what shifts are going to occur. But I didn't really answer your question, Greg. I guess the answer is maybe. Maybe we could have it. I think it just depends on what we're facing in the future and in the fall. Right now, I feel like we're kind of in a, we're in a pretty good place of immunity in terms of our high vaccination rates. And we know that a lot of people have had Omicron already, but we don't know what that changing immunity landscape will look like in the fall. And it could very well change.
Fair enough. Thank you.
Well, I just want to say thank you to all of you. And what we will do is make sure to prepare a very brief COVID update, maybe not go into the data as much, knowing that you're going to be getting the data. And I'll work with Lexi and others to make sure that we have something for you at each Board of Health. Sounds like, does that sound like consensus there? Are we good? Okay. Thank you. Oh, and I want to turn it over to Carrie Middleton, who's here to talk. I don't know if we're doing the Ncar fire. Are we doing that next?
Yeah, we are, Indira. I want to tell President Thomas and the board that we didn't specifically indicate that we were going to talk about the Ncar fire response on the agenda. And with that said, we do want to give you an update on Ncar, and Carrie Middleton from our emergency response team is here to do that. So I'll turn it over to Carrie, who's going to provide you all with an update on that particular fire ahead of the Marshall fire update.
Okay. Unfortunately, we're talking about fires in late winter, early spring.
It is. It is.
I guess there is no wildfire season anymore. It's just year round.
Exactly. And so it is unfortunate that we're having this discussion. I know that Carrie's going to give us an update on this fire that at the time that I was updated, and I think she'll verify, had no loss of life or of structure, but certainly acreage. So Carrie, if you're ready, I'll turn it over to you.
Yeah, I am. Thank you, Camille and Indira and the board. I'm the surprise agenda item. And I know it's a break from COVID, but agreed, it's a pity that we're taking a break from COVID to talk about fires. So I am Carrie Middleton with Emergency Management. I'm an emergency management planner, and my plan tonight is really just to give you just a high level, fairly brief overview of Boulder County Public Health's Ncar fire response. So once again, as with the Marshall fire, Public Health, we did respond in person to the Emergency Operations Center to support the overall response. And so our role is not only to support the overall incident objectives, but also, of course, our overall public health objectives. And so life safety is paramount. And of course, we support the healthcare system, and that includes the ancillary healthcare system. And then we also supported with communications. So there were, during the Ncar fire, as Camille noted, there were no injuries reported, no loss of life, no structures lost, but there were impacted long-term care homes who either needed to evacuate or do a partial evacuation. And part of our role at Public Health was to assist those long-term care homes with fairly complex evacuation needs. So as the board's probably aware, we do have a team at Public Health that has been working with our county's long-term care homes since the beginning of the pandemic and providing support and along the way developing really strong relationships. And so what we're finding is, as with the Marshall Fire and now the Ncar fire, that structure of support and those strong relationships are really valuable in helping us support homes in a disaster or emergency like this. We also worked with CDPHE to support those homes and are grateful for their support as well. So long-term care homes, as you would expect, do have complex needs in the context of emergency response. So we are continuing to have a conversation with those homes about emergency preparedness, what their emergency preparedness plans are. In general, our preference is, if we can avoid it, is that those homes not evacuate just because of the high needs of those residents. However, recognizing that sometimes evacuation is unavoidable, part of the conversation that we're having with county's long-term care homes is, what does that look like for them in terms of their plans for example, transportation resources and placement for residents. So again, lots of work and conversations continuing in there. Alerts and warnings have also been a challenge. And so something else that we are doing is helping long-term care homes sign up for the Everbridge Notification Center so that they can receive notifications directly in the event of an incident like this, or evacuation warnings or evacuation orders. So again, just a fairly brief overview of what we did with the impacted long-term care homes. Another highlight I wanted to be sure to mention was our work with the Medical Reserve Corps of Boulder County. And I think the board is aware our volunteers were really essential during our pandemic response. And they were extremely valuable during the Marshall Fire response. And once again, those volunteers stepped up to help with the Ncar fire response as well. So with Ncar specifically, we had clinical volunteers who went to the shelter that was at the East Boulder Community Center and supported residents who had evacuated with their medical needs. And these volunteers, as with the nature of an emergency, they deployed on pretty much immediate notice, and they were there for hours at the shelter, providing support to the residents. So very grateful to those volunteers as well for their support to the community and their support for Boulder County Public Health. We have had some after action briefings. As the board is probably aware, this is a practice that we do after each disaster or emergency, where we're looking at lessons learned, what went well, what can we improve. So we're documenting those areas for improvement, and that will inform, of course, future responses. That said, I'm really hoping that we don't have occasion to use those lessons learned for some time in the future. Yeah, there was a fire, as you might be aware, there was a fire just last week, the North Shanahan Ridge fire south of the Ncar fire. We would have responded to that in person at the USC had there been a need, but fingers crossed that we won't be coming to you with an update like this for quite some time.
Okay, thank you, Carrie. I think that's it for our CDM updates. I want to go back to a question Morgan had about Stasio. I think it's still open, but I'm gonna follow up on an email afterwards if that's okay, because I'm waiting to hear back from Chris Campbell about what is the plan for keeping it open or shutting it down. So I'll let you know. Thank you. Good to see you all.
Thank you, Indira, and your team. And I'll turn it back over to you, President Thomas, as we move forward through the agenda, because this concludes that one portion of the agenda with the COVID update. And we snuck in a little of the Ncar fire because Carrie works in Indira's operations.
All right, thank you. Item 4 on the agenda, still on fire, update on the Marshall and Middle Fork fires.
Yep. Thank you, President Thomas. And I believe it's Joe Malinowski, Aaron Dodge, and Bill Hayes that will be updating the board this evening on the Marshall Fire. We have some updates on air quality, soil, and more. So I will turn it over to Joe at this time.
Can you hear me okay?
We can now, Joe.
Yes, we can now.
Now I just got to figure how to share. I had it up, then I lost it now. Are you still seeing my screen?
Yes.
Can you see that?
Yep.
Still see it?
Yep.
Yeah.
All right, good deal. Good evening, board. Joe Malinowski, Environmental Health Division Manager. Going to provide a quick update on the Marshall Fire and just what we're doing these days on the recovery effort. I think this picture really, and with me tonight is Bill Hayes, the Air Quality and Healthy Home Program Coordinator, and also Aaron Dodge, Water Quality Program Coordinator. But I think this picture, first picture here, really shows what the phases we're moving in now. People had opted out of the FEMA debris cleanup have been doing this on their own. We start the FEMA cleanup this month. But what you're seeing is here is this would be a burned home where they remove the debris, they're scraping soil, and then you hear some of the testing results that we've done and some of the requirements around testing of post cleanup to make sure they've removed all the hazards. So really, the key points for this presentation is really going to talk about more about the surface and soil testing that we've been able to get up to date. Talk about some of the results we did on some of our small study. Outdoor air, really excited. Bill's going to share the Love My Air monitors are up. We have those in the burn area, and he's going to show you that platform and how people can opt in for notices. And I'm hearing we did a press release on that today, and I think we had over 350 people already try to sign up for the opt-in. And then I think it had thousands of hits already to the website in just a couple of hours. So that's really exciting to hear. Bill's also going to talk about a little bit of the healthy home issues and our IH, the industrial hygienist work that we have going on with our industrial hygienist. And then Erin's going to talk a little bit about some more of the water issues she's seeing and some of the test results they've gotten back now, doing some water testing on domestic wells. And then I just want to share a little bit more about some of the great work Sean Hollister's doing on communications and the post-fire hazard mitigation and cleanup guidance. So without further ado, I will turn this over to Bill Hayes.
Good evening, board. Bill Hayes, Air Quality Coordinator. And first off, we're going to talk about our soil sampling effort. And so we hired Environmental Restoration, and they took samples at 26 locations. 20 of those were home sites where the home was completely destroyed. 6 were outside of the burn area to serve as background samples. And we sampled for the entire suite of 17 metals that are included in the California Title 22 list. And we got all of the results back and had only 2 sites with results that were above the EPA screening level for residential soils. One of those was particularly eye-catching because it had arsenic levels that were above 2,000 milligrams per kilogram. And the EPA screening level for arsenic is 11 milligrams per kilogram. So, 200 times higher than the screening limit. And so we went back to that site, did a visual inspection to see if we could identify any reason that we might see such high arsenic levels. Didn't find any. So we had the contractor go back out and sample all of the adjoining and properties on that block. Our thinking initially was that this might be a remnant from past mining operations in the area, but all of our surrounding test sites came back at or below background levels. So we still don't know, exactly what's going on this site, but we feel confident that it's not directly related to the fire because the levels were so high, even at a depth of 9 to 12 inches. And arsenic isn't that readily migrating in soil. So that one is a bit of an anomaly, but the rest, with the exception of one property that had a high lead level, the rest came back, very close to background. And so that was encouraging. And with that, we talked to the state and agreed that we could scale back our testing requirements to RCRA 8 metals, so 8 metals instead of 17, and that will result in a great savings in lab fees. And so we've shared that information with the building departments, for the county, for Louisville, for Superior, so that we're all on the same page, having the same testing requirements. And so now it'll be the same testing requirements for people doing cleanup remediation on their own, or people that opt into the county FEMA PPDR debris removal program. We did not find asbestos in any of our samples, and that was, again, a very encouraging result. We've also been working closely with the Boulder Valley school districts. They were getting, obviously, a lot of questions from parents of, is it safe for our students to be out on the playgrounds, out on the sports fields? And so we made recommendations to the school district for how they should sample those. And instead of doing soil samples to a depth of 12 inches, as we did with our 26 locations, they just did soil surface scrapes. And they did that at 4 locations and 4 different schools, multiple locations at each school. And all of their test results came back in line with our background samples. And so again, that was a big sigh of relief. And so there was agreement that they don't need to take any additional remediation actions to allow children out on those play fields. And then we were able to share that information with our daycare providers, private daycare facilities as well. So like I said, that was something that we were getting a lot of questions from parents about. So we were really glad to have that answered. So that's it for the soil sampling. And outdoor air quality. We haven't had any additional drive-throughs with NOAA or CDPHE's vans for VOC since the last time I spoke with you, but they are still planning to do additional drive-throughs once the county FEMA debris removal effort starts, to make sure that that debris removal doesn't liberate any additional VOCs. So our concern really has stayed with the particulates as the ground dries out and winds kick up. And so we now have a total of 22 PM 2.5 monitors deployed throughout the burn area. And we now have just today launched our web platform that will allow the public to see that real-time data. And so I'm going to have Joe click on that link. And so the Love My Air platform, I've got to give huge thanks and kudos to the Denver Department of Public Health and Environment. They set up the Love My Air system a few years back and focused on putting air monitors at different schools throughout the city, so that again, parents could see the air quality at the kids' school, and they definitely made it a learning experience for the students, putting up monitors in the school to show what the air quality was. So Denver had a great system, and they graciously allowed us just to piggyback on top of that. So Joe, are you going to show that website?
Can you see that?
No, we're still on the slide. I think you probably have to toggle what you're sharing. Now we see you. There we are.
There you go.
Yeah. And so we were able to replace Denver's Love My Air branding with our own public health branding, and have a Marshall Fire specific page. So you can see on the map, all of those green dots are where we have air monitors. Again, we work closely with Boulder Valley School District. So 8 of those monitors are on top of the 8 schools the school district has within the burn area. If you look in the upper left corner, there's one in Boulder, and that's because the state has a regulatory grade monitoring station for PM 2.5 at that location. So we put one of our monitors at the same location that the state has theirs, and that allows us to calibrate our monitor to the state's, and that algorithm gets shared with all of the monitors. Also want to point out there's the other monitor kind of straight down from the one in Boulder to the left. Yep, right there. So that's at Southern Hills Middle School, which isn't in the Marshall Fire burn area, but it's less than a mile as the crow flies to the Ncar fire. And so we've decided to put one there as well, just to see if we get anything coming off of the Ncar fire this summer. So as you can see, when you hover over any of the dots, it tells you where the monitor is located, and it tells you what AQI it's currently measuring. And so if you click on that view button, then we go to the individual page for that monitor, and it shows us at a glance that we're in the good air quality range. This syncs up with the EPA's airnow.gov rating system. So we've been encouraging people to go to airnow.gov for several years. And so hopefully people are used to seeing that color code that the EPA created. So right now we're in good air quality. And so the suggested action is get outside and be active. Obviously, as we get into poorer air quality, that messaging will change. Then scroll down, you can see the last 7 days, what the air quality has been. And then this gives the explanation for what those colors are: good, moderate, unhealthy for sensitive, unhealthy, and so on. And then bottom is just, again, the map showing where that monitor is located. So that is the monitors. And if we go back to the main map, forgot to mention that yeah, go ahead and click on that one, Joe. So this is another great feature of the web platform. It allows residents to sign up to receive air quality alerts as the air quality moves from good to moderate to unhealthy. And people can get an alert by text, they can get an alert by email, or they can sign up and get it both ways. And they can set their own criteria for when they receive an alert. So if someone does have a pre-existing respiratory condition, they may choose to get an alert when the air quality moves into that unhealthy for sensitive population range. Whereas someone who's otherwise healthy, they can sign up only when it gets into unhealthy for the general population. And then once you enter your phone number, your email address, you can pick up to 3 different sites. So, maybe you want to pick the one closest to your home, the one closest to your kid's school, and the one closest to where you work. And this site went live just a few hours ago, and we've already had 18,000 hits on the website. So people have gone to the website, clicked different pages, a total of 18,000 times. And we already have about 350 people have signed up to receive alerts, and they've signed up to receive alerts from a total then of 900 sites. So essentially, people are taking advantage of picking multiple monitors that they want to get alerts from. So we're really excited that we've got this up. I'm very excited, and I want to give huge recognition to Sean Hollister. He put in so many hours working with Sensible, the company that created the web page for us. Making sure that it's in English and Spanish, and that it toggles well between the languages, and that everything reads properly and is easily navigatable. So Sean just did a great job with getting that website look and feel and operation, so that freed me up to get the monitors out into the field. So very excited to have that up. So that's the outdoor air quality update. And so then this, just jump back real quick, Joe. Joe showed you how to sign up for the alerts, but so this is what the alerts will look like in the text and email formats. Okay, now we can jump on to the indoor air piece. So Mike Richin, our industrial hygienist, he's working 20 hours a week and has been staying very busy responding to requests from homeowners, typically as they're moving back into their house. What do they need to test? How do they remediate? And he's been doing a lot of essentially hand-holding that's really needed by the community and appreciated. As I said, we've fully occupied his time just with people that call in, email in with questions. And so we're looking at how to be more effective and equitable with his time, and kind of cast a wider net. And one of the things we're looking at doing now that we've kind of got our set of frequently asked questions, we're looking into creating videos of Mike, explaining how to check your oil, your air filter in your house, how to look at a bid from a contractor to see if remediation charges are appropriate. So that we can give his knowledge to a wider range of people. And we're currently planning on having Mike on board with us through August. And Morgan, I see your hand.
Yeah,
up.
thanks, Bill. First of all, I share your enthusiasm about the air monitoring website, so that's great. Thanks for everyone's work on that. Question about the industrial hygienist. My understanding is that there are some funds available to help folks who have smoke and ash damage, but not burn damage, to be able to remediate in various ways. Is that part of, or I guess, is the industrial hygienist familiar with that funding opportunity, and are those connections being made to help support folks who are in need of, who might not have insurance coverage, for instance, or are underinsured on smoke and ash damage?
Yeah, thank you for bringing that up, because I know that there's a lot of different ways folks can donate to help out residents of the fire, but I hadn't heard how to access that yet. I was going to sneeze. So if you know specifically and can forward that information to me, or I can do some research to find out. But yes, we should definitely be sharing with folks how they can get some financial assistance with the remediation.
Yeah, I think, originally I think Elevations Foundation had made some funding available, and then I think the Community Foundation has made additional funding available. for, again, specifically smoke and ash remediation. So I'll see if I can track down who at the county is heading that up, because I think the Community Foundation has been working with somebody at the county to ensure that that funding is available.
Yeah, that would be ideal. And it's been interesting to see what insurance does cover and doesn't. Well, that's my portion. So thank you all.
Next, we're going to move into water quality and ask Aaron Dodge, our water quality coordinator, to present this piece.
Great, thanks, Joe. Erin Dodge, Water Quality Program Coordinator, and I use she, her pronouns. And you're just trying to cut to the end. Yeah, right there. Perfect. So early on in the response, the recovery response, Purdue University had come out and was helping support the private water systems like the town of Louisville, town of Superior, and we had one community system on a well that's also regulated by CDPHE, and helping them navigate. And they offered to do a small handful of testing of private wells. And we were able to get those preliminary results from what they had sampled. And when I say a small number of, I think they only tested about 15 wells in total. And so the two constituents that stand out from the testing are lithium and vanadium, which are both metals, very likely naturally occurring. We're not at this point suspecting that these are coming from the fire, that they're just more naturally occurring in our soils. And so we have worked with CDPHE and Purdue University to develop some fact sheets and to share with residents, and updated our website with that information. And some of the wells that they tested were, in this picture here, the bottom picture is a wellhead that is, you can see that it's all burned around it, but the wellhead is intact. In some cases, what they found when they went out to sample was just the wellhead was also destroyed, because it was maybe just in like a wood structure and it wasn't open to the ground under there, or just had like a piece of plywood over it inside the little well housing. And in those cases, they were finding VOC contamination. And early on, that's what they were finding with the public water systems, was that VOC contamination was probably getting backflowing into the distribution system and being, from the fully damaged homes, and then being pushed through the distribution systems to homes that were still standing. And they were finding concerns with VOC contamination. And so when the wellhead was completely destroyed, there was usually debris floating in the well, and it was not unexpected to see the VOC contamination in those wells. But in wells, for example, where the wellhead was still intact, VOC contamination was not something they were finding a lot of in private wells. We do have some questions around, we know of at least one well that served 8 homes, and that well is not large enough, or that system was not large enough to meet the requirements for being a community system to be regulated by CDPHE. And we do know that in the other community system that's on a well, that they also did find some of that VOC contamination. So we're strategizing with our team right now to put some messaging out for folks that might have shared wells, so that they'll contact us and we can help them navigate testing recommendations and what they should do. I think the bigger concern is when you have a house that's still standing and some that are destroyed, and if those shutoffs aren't made to the properties that are destroyed, is it impacting water in that distribution system? So Overall, for private wells, individual wells, we have not changed any of our guidance that we shared with you last month. But we are still working through figuring out what our guidance is, if we're gonna have some additional guidance around those small non-community system wells. They're still considered a private well, but serve multiple homes. Okay, Joe, you can jump to the next slide, please. And so just really quick, for septic systems, we are going to be conducting damage assessments in April. We've had a few complaints from residents or concerns. I don't really want to say complaints, but concerns about septic tank lids that have melted. So sometimes they have plastic risers to grade. And so you can see the top two pictures there are some of the damage assessments that the team has gone out and conducted and found that, in fact, that riser is gone and there's just an open hole into the septic tank. And so wanting to make sure those are covered. So we will be going out and doing that here this month. And then we will be sending not an enforcement letter, but just an FYI letter to homeowners. And just so that we can also track that from a safety perspective, if a contractor were to contact us and they were going to be doing work on the property, just so that we have situational awareness of the condition of that septic tank. And then of course, we'll be looking for any other signs of failure, but since we'll be visiting destroyed properties and there's probably no water going into that septic system at this time, very likely not expecting to see a lot of failing septic systems at this time. And so that is all I have for water. I don't know if anybody has any questions.
We can take questions at the end as well. Thank you, Aaron.
Great.
So last but certainly not least is our efforts in communications. Just again, Sean Hollis is just doing a great job of keeping us updated. It's where we spend a lot of our time working with him to try to update our communication and make sure it's being adjusted for the different audiences that we're trying to reach. But really around outdoor air, it's still those air quality updates that Bill just shared with you around the Love My Air site, and those indoor air quality notices. You know, Sean really worked on all those in that format. Developing parks and open space recreation precautions. I'll show you an example of that here in just a second. And then continually just to do communication around indoor air and the cleanup involved there, and the ash and soot cleanup, the well water precautions and testing that you just heard from Aaron. And then some RIH is working with him also around selecting a contractor and some of the things to watch out for on unfair practices that perhaps we're seeing. And then just some of the garden guidance out there. We know that people are really wanting to start their gardens, if not already started those. So just a quick example of some of the information that Sean has developed. These are more specific to if you're out recreating versus schools, and then a Spanish version of that as well. But again, it just reiterates really trying to direct people to the website and trying to get those opt-in text email alerts, and then going through the website to look for the precautions they need to take, depending on that air quality notice. So again, I just want to thank you for the opportunity tonight and happy to answer any questions.
No, I mean, no real questions, Joe and Bill and Aaron. Just thank you and appreciation for all the hard work that you put in. I'm glad we could be a small partner in your efforts. And I'm glad also you didn't really see, did you guys really see much of a dust up from any of your sites with all the winds of the past week?
Bill, you want to talk about that a little bit? We did.
Yeah.
There was definitely some dust blowing, but we think it was probably bigger particles than the air monitors are picking up, because they're geared toward the 2.5 size, and we think it was just bigger than that. But
okay.
Yeah, and I was expecting, you know, because I could see visible dust being kicked up. The PM 2.5 is, you know, too small to see, you know, visibly, but we just assumed that it would be coming along for the ride. And so again, really fortunate to have so many experts, and I immediately sent out an email to folks at NOAA and Ncar in the state, and immediately got all kinds of replies. Basically, what Joe alluded to, that the big particles blowing don't necessarily equate to the small particles, because we weren't seeing it on the monitors. And I kind of had them. I checked with the manufacturer because I thought, well, maybe in really high winds, the monitors, their sampling ports aren't able to pull in samples, but got assurances from the manufacturer that that's not the case. I will say with the Ncar fire, we got some very interesting readings because I was in the pre-evacuation zone. So as soon as I had everything staged at the door, I immediately logged on to look at the monitors. And within a half hour of the ignition of that Ncar fire, our first farthest west monitor sharply went up. And then you could see the time delay as the smoke moved from west to east across the monitors, and each successive monitor started picking it up. And, as expected with the dispersion, each successive monitor had a lower spike. So that was, well, I'm not glad we had the fire. It was a good opportunity to test the network and see that it is working properly.
Okay, well, thanks again.
Thank you.
Okay, any other questions on this from the board? Not seeing any hands. Okay, keep up the good work, everybody. I'll hopefully hear back from you soon. But no new fires, please. All right, let's see. We are at item 5 on the agenda, which is director's report.
Thank you, President Thomas, and yeah, excellent work by all staff who presented or worked behind the scenes to get these presentations ready. There's so much going on, even with work, I'll say that staff are doing to find funding to keep those air quality monitors on for years to come. So we'll update you more on that when that's appropriate to do so. But as far as the director's report, a couple of things that are not written inside it, an update for you on what might be next for us as far as meetings. I got an update today from our county partners. And they're experiencing some of the same things that we are at the Boulder campus, especially in becoming what we're calling hybrids. So you should know that our IT teams and even electricians are working hard to make the technology available in many of our conference rooms so that we can be hybrid, so that some people might be remote and some people might be in person. And that was always a thought of an option for the Board of Health. It isn't something that we could do right now at the Boulder campus, for example, because of back orders of equipment and so many orders to make that technology available to that campus. And our county partners and the commissioners' hearing spaces are experiencing the same issue. And so I received an update today that it might be towards the end of May and even into the beginning of June before their hearing room would be available for us to use. And so I'm certainly ready to hear your thoughts now, or I can connect with each of you later as you ponder how you'd like to continue. Obviously, hybrid might not be the option without the technology available, and it might still be that May is still a totally virtual meeting. If that would change, we are willing to work on our staff doing the behind the scenes education and training to make hybrid work, and we would communicate with you as such. But at this point, because of our inability to have all of those rooms technologically ready, it seems, President Thomas and the rest of the board, that we might be virtual for at least one more month. Hopefully not 2 more, but at least 1 more. And so you can always reach out to me if you have other ideas or thoughts or concerns about that, but I certainly wanted you to know that. One other quick thing, if there's no questions or concerns there, I want to introduce someone. Her name is Jordan Thomas. Jordan is going to be working with you all very closely. She is taking a position that used to be held by Tammy Golden. I think perhaps Member Hinman might be the only person that didn't get to meet Tammy Golden, but it's a revamped position for Jordan to do the work of supporting the board and taking minutes and doing all the agendas, but also to do some special projects for the department, especially for the leadership team. I'm going quickly over this, but I wanted you to know about that, because in that we can't not say thank you to Rita Mangin. So Rita supported all of us during my entire tenure, almost 10 months now, and we just want to thank her, doing an excellent job in some interesting times, as we mentioned previously. So you'll get to work a lot with Jordan. She's from the Midwest. She has her master's in public administration from Southern Illinois University, as well as her bachelor's in psychology, and worked in local government in Ohio. So supporting contract administration and supporting boards. So I think we've all been so happy to have Jordan, and we're so grateful to Rita. She will continue to guide us in our expertise, but I did not articulate that in the director's report. So with that said, we have many of our department or division managers here. Sorry if you have questions about anything in the director's report. I'm happy to try to answer. Deputy Director Nolan could, or any of our division managers that are present tonight. Member Hinman. Oh, sorry. President
no,
Thompson.
that's fine. Go ahead.
Member Hinman, do you have a question?
I do. Well, first of all, thank you, Rita. Welcome, Jordan. Exciting. I just wanted to get a little clear on the strategy work going on, and what ultimately that is leading to, which is my impression is there's going to be a refresh of the strategy for 2023. Is that correct? I just wanted to clarify.
Absolutely, Member Hinman. I'm happy to just briefly, because I did mention that in the director's report. The existing strategic plan for Boulder County Public Health actually does expire at the end of this year, at the end of December. And so the time is right for us not only to provide you all with updates on progress or achievements made in that plan, and I did not articulate that inside the director's report, but that will be happening. And concurrently planning for what are the priorities that we want to map out in our strategies for 2023 and even beyond. And so some of that work is already happening. We're starting by doing a strengths, weaknesses, opportunities, and threats exercise with every single individual in the organization. We're going to work with a book by Patrick Lencioni called The Advantage. The leadership team is reading it right now, and we're going to work inside of that book to answer what he calls the 6 critical questions. And basically it allows us to examine why we do what we do, and how we do it, and who's going to do it right now. That's only 3, but there are 6 in total. And it really allows the organization as a whole and every single person in the organization to answer those questions. And that helps us formulate, do we need to update and refresh our values, our mission statement? Maybe we will, maybe we won't, but it gives us that opportunity to use that data from answering all of those questions to formulate any sort of next steps we have in refreshing our brand. And then it also helps us decide what will our strategic map look like. I call it a map. It's really a plan, Member Hinman, but it's presented as a 1-pager map that every single person in the organization will have at their desktop or pinned to their cubicle, and really always be one with a working document of our priorities for the year and years to come. And we'll certainly be updating the board on our progress of that, and also to get your input at some point on what you might think the priorities are. At the end of the day, there will be an agency-wide strategic map with projects underneath that we will complete, but also each division. So you saw Dr. Gujral here tonight and Joe Malinowski. They'll also have a map with similar structure, but indicative of their priorities as well. So it allows acknowledgement of all the amazing work that each division or program is doing, while also allowing each and every person in the organization to have knowledge of what our strategy is, and we'll be measuring it constantly in regular meetings. So that's just a quick snapshot, but we're just starting out, and it's an exciting time. Maybe I might be the only one that's really excited because I've worked in this structure before and had success with it at other agencies, local and state. But everyone's been great to want to roll up their sleeves and participate in this next endeavor. I don't want to leave out that it's also going to be time for us to do a community health needs assessment. And that will be part of the strategic map. It won't be the driver of it, although there could be pieces of it that each and every division works on. So if mental and behavioral health, for example, continues to be one of our priorities, it could be that the leadership of this organization decides, you know what? Every single division is going to have that as a priority in some way, shape, or form, so that we're all thinking about our priorities in and how they affect the work that we do within each division. Hope that makes sense. I'm always happy to talk about it or to give you updates in the director's report each month. And then if you have questions, we can definitely talk about it.
Yeah, that's really helpful. And I just a follow-on question. So because I'm new and I'm still learning the role of the board, is it safe to assume that the board is involved in the final sort of blessing, if you will, of the strategic map, or how does that work?
I would have to lean on President Thomas on that one. It would be my style to definitely bring it to you and have you, as you said, bless it. I certainly would not want to implement a strategic plan that you did not agree with or that you didn't have input into. But I didn't really ask President Thomas if that was something that is traditionally an action item. I would hope that your executive director would provide it to you to give a blessing, but I'll turn it over to him to give that final answer.
Oh boy, you're testing the memory banks here. Let's see, last strategic plan was 2017.
Yeah, 5 years old.
I want to say that we were presented the plan by the leadership team, and I don't remember if we took like a formal position on it. I do remember that we agreed the strategies were the right ones for that 5-year period. But I can't recall if it was a formal vote or not. If any of the staff remember, please chime in.
I guess I don't remember. I feel like we did formally adopt the strategic plan. I don't remember having a large role in editing or determining any of the aspects of it. So I know that in the past there have been sort of invitations for the public to participate in various informational sessions and surveys that were available so that members of the public could weigh in on what they felt were important health issues for our community. But I don't think the board, Lindy, took like a real active role in that unless you participated in some of those sessions.
And I do remember there being a public session on the mental health priority. And I think that was in Longmont, and I'm pretty sure I attended that, and that was good because it did allow the public to offer input as well. But you know, my kind of reaction is that I do think this board, you know, it's just boards change over time, right? And I do think that this board will have a much higher level of interest on the new plan. And so, yeah, I would envision us wanting to formally take, you know, to bless it when it's ready.
Excellent. Thank you.
Sure.
Any other questions for me about that or the director's report in general?
Yeah, I was just, Morgan somewhat answered my question. I know that the cities, so Boulder City and Longmont, have adopted this new process for creating master plans. And I was just curious if you all had looked at the city process now, because it involves a lot of public input. And especially after COVID, which has brought public health into a very hot spotlight, it might be a nice idea to use some of that model to solicit a lot of that public feedback for the new health master plan.
Certainly. And I think for clarity's sake, most definitely for the community health needs assessment, it is very important to solicit public input and hear what the public feels are the priorities. I have a style where I integrate the results of the community health needs assessment into the strategic map for the agency. So certainly as we work on this journey together, if there are recommendations that you have for the leadership team relative to public input on the strategic plan for the organization, I would always be open to hearing that. The community health needs assessment definitely gets that public facing, and I think that's might have been what President Thomas was alluding to on the mental and behavioral health side, wherein staff reached out to the public and held spaces for the public to provide their input. And that timing is interesting because we're doing it at the same time, but it certainly can be done and staff are at the ready to effectuate both of those successfully. Oh, I'm sorry, Lindy, you still have your hand up. Did you?
I have
it?
one more question.
Of course.
Totally unrelated to this topic. So I read in the report that for the test and treat plans, it's looking like you're encouraging participation from the FQHCs and also Kroger and King Soopers pharmacies. Obviously, especially the FQHCs, I feel like are important, access points for our population. I'm just curious to know if there's resistance there, or if it's just a matter of getting them to participate and what the issues are there potentially.
I was trying to unmute. I don't know if Dr. Gujral is still on or if any of her staff who presented are involved in these discussions. I think what I have observed, at least from afar, is that it's just a shift in how those partners have been involved in this particular activity. And I don't think there's resistance per se, but just a shift and a paradigm shift, if anything, because we can't continue to be in that space either. It was a shift for us to take on some of these roles, and certainly the state supported us to do so. But Indira, did you have anything to add to that, if I may put you on the spot, or even Lexi, if you know?
Yeah, so we are doing a full kind of deeper dive into the test to treat. We do know that some of these partners have kind of signed up at the federal level to do test to treat. And we know that the FQHCs in particular are going to probably be super important and play a key role, particularly for our low income individuals in our community who might not have access to at-home tests, and then with the community testing potentially going away, that can have a huge impact on them. So what we do know is that the state has set out a health alert network, which just described the test to treat program, where it says who's eligible, because not everyone is eligible, but a lot of people are eligible for test to treat. It also shares kind of the process where you will actually get tested and then referred to a provider on site to get treated. And I think that might be where some of the hangups are, is just making sure that some of these healthcare systems have the staffing and the capability to be able to manage this. So Kelly McLaurin, who is a trained physician assistant and has been the epi lead of our outbreak teams for communities and business liaison, she is actually in this space working with the state to figure out how to set up the system so that we understand exactly how to communicate to the public. So that's partially why we're holding off on any communication out, is we want to make sure we get it right. We know that it's going to be super important that that system is set up. And so it's just a partnership with all these healthcare providers. So I'm sorry I don't have more, but I can tell you that we are doing more to look into it all the time, every day.
That's really helpful. Thank you.
I just wanted to add, I work at Clinica, the FQHC in Boulder, and there's a lot of issues because patients will be coming in who aren't already patients. And so the way, our healthcare system as a whole is set up, it's very hard to provide medical care to people who aren't registered patients. So it's much more straightforward. I mean, for our own patients, we're already doing testing all the time and giving them free kits and all that stuff. But to be doing a referral to treat and then treating potentially someone who was not registered as a patient is a really different model. Right? They'll have to be registered clearly in some way for that to take place. But I think there's just a lot of issues in our healthcare system. And healthcare delivery to people who are not already registered patients is a challenge.
Yeah, just to build on that just a little, thank you, Landry. That's a great point, and it really brings to mind the context of we're in this really messy phase right now of saying what is the health system's role in this ongoing pandemic work, and how are they really still building the systems and the structures and the funding flows to be able to accommodate those ongoing needs in a way that they haven't had to previously, with that expectation going forward, even as they still are recovering their staffing and stabilizing their inpatients and everything. So it's part of that larger transition to normal that we're all talking about, and just figuring out what does this mean for different populations who have different kinds of challenges in getting those resources.
Yeah, absolutely. I should let it go so the meeting ends, but setting aside how many rooms, and that's going to wax and wane with COVID, how much staff should be dedicated to this stream of patients as opposed to registered patients. How do patients find out about it and get an appointment or even a time slot? There's so many issues for people who are just walking in and not already registered patients. There's just a lot of challenges. It's not like a grocery store type situation.
Okay, thanks, everybody. Any other questions on director's report? Okay. So old and new business, usually don't have anything for there, but I did want to give an update on the what we worked on partially in our executive session in March. So the intent there was for us to craft a survey to get feedback on the upcoming performance review for the executive director. I know it's been an odd year, because we were, just still in the midst of COVID. And so a lot of the normal things that would have happened in more normal years did not. But now that we're moving toward the endemic stage, and as we are continuing to get back to staff's regular work, I think it's a good time to release that. And so been working with Julia Larson and Human Resources. And so just an update. So Human Resources will be sending out a survey starting tomorrow, and it will be open through April 29th. And for the board members, it's difficult to really do this iteratively because of open meeting laws. And so what it looked like last month did not change. And so I think it's broad enough yet concise and allows people to really kind of maybe spend 10 minutes at most to be able to answer those questions. So look for that to be released tomorrow. It will be released to all BCPH staff. The only kind of question that we asked to try and delineate from is, do you supervise people or do you not supervise people? Just so we have a sense for, the kind of the degree of interaction. But that will be administered and run solely through HR. The board will not have involvement until we get the results, and staff will not have involvement. That'll just go through HR. So I wanted to provide that update.
Hey, Greg, quick question.
Sure.
So will then basically the raw collection of the responses, will that be provided to the board? Is that the plan?
I think so. They're using, Brooke, they're using a different platform. I think it's called Microsoft Forms. I'm not used to that one. I'm used to SurveyMonkey. But Julia had indicated that's a common thing they've been using over the years, and didn't seem to indicate that it would present any limitations on how we receive the data. Okay.
Thank you.
Okay, any other old or new business? Okay, that brings us to the last item, which is we are adjourned. It is 7:03. And so it seems odd to be ending so early after all these months of COVID, but I don't think anybody is too upset. Keep up the good work, everyone. Thank you for your input to the updates, to the director's report, and enjoy the spring.
Thank you.
Thanks, guys.
Bye.
Thanks.